Oh, there he is.
Sorry. Oh, there he is. Oh, I'll move out of the way. There we go. Okay.
People give their doctors a lot of credit, and they should, but don't forget about your pharmacist. After going to the doctor and receiving a prescription, you go to the pharmacist who fills it for you. Many people think that he or she just reads the prescription, goes to a jar of pills, places them into a bottle, and hands them off to you. A pharmacist does much more than just that. They can tell you a lot about medications and the components, more than most doctors. Pharmacists study the components of different drugs, the weights and dosages, and how they can be administered, and so on. Recently, I met with my local pharmacist, Joel Lugins. He is employed at our local pharmacy, Lewis Family Drug. I am also employed there and hope to someday become a pharmacist. I interviewed Joel because he is someone that I look up to and is very good at what he does. I feel comfortable asking him questions and talking to him about his profession. I talked to him about setting up an interview so I could get more in-depth answers. One evening we met at his house and talked about what he does and the process of pharmacy. I asked many questions to get a better feel of the pharmacy field. The interview went very good, and he gave me a lot of answers and was excited for me to learn more about what he does. The interview kept a very nice flow, and questions connected from one to the next. During my interview, I asked Joel. Joel said that he decided to become a pharmacist because he didn't want to go to medical school for that long, but he knew he wanted to help people in the medical field. He weighed his options, and it came down to 5 years of pharmacy school because that extra 5 years or so was just too long. Those 5 years put Joel's education level at a BS in pharmacy. Pharmacy schooling has changed now. Nowadays you have to complete 6 years of pharmacy school and then you finish as a doctor in pharmacy. For Joel to go back and complete what would be 2 years now doesn't seem worth it. He says he learns a lot more by actively working in his field. The most important thing Joel said he has learned as being a pharmacist is better living through medicine. He thinks that the development of medicine for different ailments and diseases has allowed people to live a fuller life. Joel believes that he has become more personable since he began. He does a lot of patient consulting and advising. He has learned to deal with many different kinds of people and different levels of knowledge. He also said since he began, he has to change the way he does things legally. Back in the day, insurance didn't exist for medications. Everyone just paid in cash. Today, he has learned to become an insurance expert. In the world of pharmacy, verbal communication is critical. If you cannot talk to each other, the message that needs to get across gets confused. While dealing with medication, it is very important to get the correct message to the person. If the wrong message gets to the person, it can cause major damage in certain cases. Written communication is also important. Joel said as a pharmacist, he needs to be able to write on different levels. If he's writing instructions to a parent, he writes less in depth than if he was writing to an elderly person that can't remember things. He also has to look at what the doctor has written him, in which is a more complicated form of writing, and uses more in-depth terms that need to be relayed. It is extremely important to be an effective communicator. Like he stated before, it is important to convey the correct information to a patient. When we struggle with this is when we get stuck with language barriers. Communication can be difficult and you can't understand each other. The only way we can break this barrier is through technology. Not everyone is fluent in multiple languages. Open-ended sentences are a way Joel uses to effectively communicate. Asking open-ended questions are very important so that people tell you exactly the symptoms in which they are having. By asking a straight-on question, the answer is normally yes. Whereas if you ask them to tell you how and what they feel, they are more likely to explain the symptoms better. The tell-back method is also something Joel uses for effective communication. But you don't want to make someone feel stupid. But by having a patient tell you what they have comprehended back, you are assuring that they know exactly what they are supposed to be doing with their medications. The ages Joel said he encountered the most were parents and the elderly. When dealing with parents, communication needs to be very detailed. Parents want to know every single detail as they are protective of their children. They want to have all the information given to them. When he works with the elderly, he needs to keep information simple. You don't want to overload them. Sometimes for the elderly as well, you need to put extra stickers on their bottle as reminders. All in all, I learned a lot about my career path. This interview gave me a lot of tips to keep in mind when it's my turn to consult people. I learned a lot about working with patients. Not only did I learn things from the interview, but I have also been able to learn things from working under Joel. He is a great teacher and is always trying to teach me new things. There is always something new to learn, and by having a one-on-one interview with Joel, I feel like I got more in-depth answers. I find the topic of pharmacy intriguing no matter what is being talked about. If anything has changed in my mind about the career path of pharmacy, it is that I'm more excited to start my journey. It may not be easy, but it will be worth it. During my time in pre-pharmacy and pharmacy school, I will work on developing good listening and speaking skills. There are two aspects of good communication. Pharmacy is a career that requires the capability to communicate. I look forward to continuing my education and working under Joel and learning more and more every day. Joel has worked harder to get me on the path for success in the pharmacy field. In my future, all these things will pay off. I am thankful to have him as my mentor. Now, next time you get your medications from your local pharmacy, be sure to thank your pharmacist for all that they do. Along with your doctor, they help put you back on track to feeling better. Pharmacists need some credit too.